So first off, I'm Jackie Fischer. I'm from the Department of Medicine. Thanks for coming today. This should be a fun discussion, I hope. This talk is for any teacher who works with learners at any level or at various levels, no matter the setting or the content. Because of course, we have the formal levels, students at various levels of their medical school training, and trainees, intern, resident, fellow, etc. So those are obvious differences in levels, formal levels. But we also know firsthand very clearly, right? You don't have to teach for any time at all before you appreciate that with any formal level, there are various levels as well, different levels of aptitude, of motivation, of skill, of interest in various content areas. So it can be challenging, even if you have what you think is a homogeneous group of learners, they can actually be quite heterogeneous. Every single teaching episode involves a teacher, a learner, and content. And there's a bi-directional interaction between the teacher and the learner, between the learner and the content, as well as the teacher and the content. And all of this happens in a context or in our type of teaching, which I feel is especially complex. Various contexts, be it in the lecture hall, in the lab, in the simulation center, on the wards, at the patient bedside, in the hallway, at the bedside, but with the family, at the bedside, but without the family. So how do we set up ourselves for success in teaching multi-level learners? Well, we aim to do these today. For the next 40 minutes or so, let's characterize what's known regarding best practice in teaching multi-level learners. Let's equip participants with new concrete strategies for enhancing their teaching of multi-level learners. And then let's practice applying some of these teaching strategies of situations of multi-level learner scenarios that involve commonly faced teaching challenges. And I like this because it added some behaviors and definitions to the things we kind of talk about in paragraph form, but it's hard to remember to do. So this list moves through quickly, but I think it's well worth the time to do so. So I'd like to take the next 5 minutes or 10 minutes at most, maybe, just talking through these. So the first is broadening. Broadening is when we change the details of a question or a case to make it more challenging or interesting. So let's say, and this can be applied to any group of learners, whether they're all at the same level or at their different levels, but let's say that you have a student who gives a presentation on a patient case and they give their assessment and plan and you maybe talk through it with them. Well, why stop there? Why don't you say maybe to the next level up of learner, let's take this same case, but what if the patient were immunocompromised? How would that change your antibiotic plan? And then depending on the size of your team, why stop there? Maybe to the next level of learner, how else would the overall management need to change if the patient was immunocompromised? That way you take the teaching, the presentation, the active part on the learner, and then the questioning beyond just that learner. There's a mistake made in clinical medicine, in my opinion, that everything is very centric to the learner who has the patient case at the time, and everyone else has this very human tendency to disengage until they're up and they're the one who's going to do the entirety. So involving the learners that way through broadening, just change, everybody's heard the whole case, just change a piece and keep involving everyone. Targeting. Direct questions to specific team members based on the difficulty of the question. So let's just take an example where everyone's at the same formal level. Let's say we're in a M1 or M2 histology lab. Maybe you yourself, from your experience with these learners, you know that which learners are struggling and which ones are experts. So maybe to a struggling learner, can you point out the lymphocyte? Maybe to your average learner, what features make you call this an atypical lymphocyte? And then to your advanced learner, what can an atypical lymphocytosis mean clinically? So this is a way where you can involve everyone with just a little forethought. Novelty, as it sounds, simply means offering new or original information. At first, I struggled with understanding why the medical education experts felt this was something for multi-level learners, as compared to just learners at large in general. In my opinion, it's not, but I think if I can put words into their collective mouths as medical education experts, I think they just recognize that everybody probably responds to novelty. So no matter who's in your group and what levels they are, it's kind of a slam dunk typically. So novelty. So maybe you as the teacher tell the group of learners, I'm sorry to hear that this patient has lung cancer. But I just saw this morning on my Journal Watch feed that there's this novel new agent for her type of lung cancer. Have you heard of it? Or, as is the case so often, the pharmacology is exploding. I just saw on the TV last night a commercial for this medicine that I've never even used, or I didn't even hear of it until I saw it on the TV. And that's real. That happens now. And they might engage in that way at new information. Up the ladder, just as you might guess, this means intuitively. So direct the same question to each learner moving from the quote lowest to the highest level of learner. So by this, I don't mean necessarily the quote worst learner to best learner or anything derogatory by lowest, but rather just, I think you know what I mean. When there are formal levels present, the earliest in training to the most, advanced in training is what I'm saying. What could this look like? Well, thrombocytopenia is something you're going to see a lot. There's a lot of things that can cause it. Let's start with our student and work our way up, going to the intern, then the resident, then the fellow. Let's try to make it around the circle twice. Student as teacher, or maybe better said, learner as teacher. So direct a learner to teach the other learners. Joyce is an advanced but bored M1 student in a small group learning about physical exam. You could say, let's change it up today. Instead of me demonstrating this, why don't you, Joyce, show us how to examine the thyroid? Multi-answer is a situation where the teacher can seek multiple answers to the same question from the various learners. This is similar to up the ladder, but whereas up the ladder kind of connotes a structure where you're always starting with the quote lowest level learner and moving up, multi-answer can start anywhere. What are some things that could be causing his acute monoarthritis? Why don't you each give me one thing that could be on the differential? You can start anywhere. The key is to just give everyone a prompt to speak and contribute. The next one, the experts call and there's one tip on the multi-answer, in my opinion. I think a mistake that's made is that sometimes, again, like one learner gets not only the case presentation, but they get all the questions and everything, whereas we don't have to do it that way. I think it's just habitual sometimes. So don't make all the learners listen at length to one learner giving multiple right answers. When you question, proactively think ahead of time how you don't want to do that. That would be my suggestion. So if John presents the case and then there's a question that say you ask of John, that's fine. But if it has multiple potential answers, ask John to give you one and then ask all the other learners to give you one, or same thing for small groups or team-based learning or anything. And especially when learners come to know that that's your style, then they'll be more engaged in listening throughout, and they'll, in my opinion, learn more as well. Same thing, like just simple things where you have somebody read the case. It's very often, I've just watched this for decades, like when teachers have learners read a case or read something or a question, it's often that same student reader or learner reader that's asked to then answer the question. So why not have one person read, tell them, let them know ahead of time they're not going to answer the question, they're just going to read, then ask someone else to answer the question. These things seem very elementary, but they actually do make a difference, and they're very easy to employ. So back to this one. So the expert call it no right answer, but I changed it to no wrong answer because intuitively that is more what I think of when I think of this concept, which is to ask questions that allow opinion or latitude in response, and that have no wrong answer. For example, this dad seems so upset about his son's new diagnosis of autism. The more I talk, the worse I think he feels. Have any of you ever felt like that when talking to patients or families? This is a great technique. The hierarchy kind of disappears when you ask these kind of questions. The students no longer feel junior or as junior to the senior residents. So it's a great way to level set. It's a great way to start off a session, to get people just talking and comfortable with that. And it's also a great way to reset if in using some of these other techniques, the learners are having a hard time giving answers or correct answers to the questions that are being asked of them. Teaching to the top, as you might intuit, that means teach to the most advanced learner. So for example, this is you talking. This is a fellow level question, or this is a M2 level question, you might say to a group of M1s. This is a fellow level question that I don't expect the rest of you to know the answer to. However, I think we can all learn from this. Sarah, what are some infectious agents that have been associated with transplant rejection? So as the scenario, the quote connotes, the idea is that you don't have to be to that level to still learn something at that level. But it's very good when using this technique to couch what you're saying. Because if learners are asked something that is way above their level, anxiety will overtake their ability to absorb the information if they don't understand clearly that they're not at risk of being called out on something that they can't be expected to know. Extreme challenge has some similarities to teaching to the top, but as the name indicates, a little bit more extreme. So teach to a level above all the learners. Something like between now and tomorrow, I want each of you to read up on cystic fibrosis until you've learned at least 2 new things you didn't know before. Thus prompting each learner, no matter which level they started at, to get to a place that was above where they were beforehand and advance.